Hi everyone. Today I'm diving into trigeminal neuralgia, or TN, a condition that's as tricky as it is painful. Let's break it down. First off, TNC is defined by sudden, severe, stabbing pain that typically affects one side of the face. This pain is linked to the trigeminal nerve, usually hitting the V2 and V3 branches. Even a slight touch can trigger an attack. Next, we come to diagnosis. Diagnosing TN is primarily clinical, based on the patient's symptoms and medical history, but to get to the root cause, imaging is crucial. I recommend a brain MRI with and without contrast, and an MRA to check for any neurovascular compression or structural brain issues like tumors or demyelinating lesions. Now let's talk classifications. TN can be split into three categories: classic TN caused by neurovascular compression, secondary TN resulting from conditions like multiple sclerosis or brain tumors, and idiopathic TN where no clear cause is found despite thorough testing. When it comes to differential diagnosis, it's essential to rule out other conditions that might mimic TN, such as other cranial neuropathies or dental problems. Moving on to management. The first line of defense is preventive pharmacotherapy. Carbamazepine or oxcarbazepine are usually the initial choices backed by clinical trials. If these don't work, we might switch to or add gabapentin, lamotrigine, or baclofen. For those troublesome breakthrough pain episodes, short-term adjustments in preventive meds can help, along with options like intranasal lidocaine or subcutaneous sumatriptan. For patients who don't respond to medications, surgery is the next step. Microvascular decompression is recommended for those with classic TN who can handle major surgery. Other surgical options include rhizotomy or stereotactic radiosurgery, especially for secondary or idiopathic TN cases. Finally, let's discuss prognosis. TN can be unpredictable. Patients might experience pain-free periods followed by severe episodes, with recurrence being common. The condition often fluctuates in terms of pain severity and frequency. So, to wrap it up, understanding TN involves recognizing its hallmark pain, diagnosing it accurately with clinical and imaging tools, and managing it with a combination of medications and, if needed, surgical interventions. Staying updated on the latest treatment protocols can make a significant difference in patient outcomes. Thanks for tuning in. If you found this breakdown helpful, don't forget to like, subscribe, and hit that notification bell for more medical insights. See you next time.